Hello, I'm Patricia Henderson, Outreach and Community Services Manager at Senior Connection Center, and this is your Community Connection. November is American Diabetes Month. According to the American Diabetes Association, about 11.3% of the American population live with diabetes, and about 1.4 million Americans are diagnosed with diabetes each year. In Florida, over 2 million individuals have diabetes, and almost 6 million have prediabetes. Here today to tell us more about diabetes is Sarah Podufal. Sarah is the nurse practitioner and director of diabetic testing at Network I. Sarah, thank you for being here today.
Hi, Patricia. Thank you for having me. Happy to be here.
Briefly, Sarah, please tell us what is diabetes?
Sure. So diabetes is a disease process in which we have too much sugar in our blood. So there are two general categories of diabetes, type 1 and type 2. Type 1 usually occurs in adolescence due to genetics and factors out of our control. And type 2 is what we will spend most of the rest of our discussion here today talking about. And most people living with diabetes do have type 2. Normally, sugar is moved from the blood to the body cells for energy by the hormone called insulin. When you are living with type 2 diabetes, there is a resistance to that insulin, meaning your body can't process that sugar properly.
What are some of the risk factors for developing diabetes?
So some risk factors for developing type 2 diabetes include being overweight or physically inactive, those who have a genetic predisposition in which they have a higher risk due to their genes and genetic makeup, so their parents or siblings may be living with diabetes. Certain ethnicities have a higher risk factor as well. Those living of African American and Hispanic descent have a higher increased risk, along with those living with high blood pressure and high cholesterol. And Patricia, you mentioned prediabetes in your intro, and that is also a risk factor as well. And those people living with prediabetes, that mean they have a higher blood sugar than normal, so we monitor them more closely. If lifestyle changes are made, such as diet and exercise changes, this can help lower your sugars and help prevent developing type 2 diabetes.
So how does diabetes affect vision, or does it affect vision?
Yes, so it does affect your vision, Patricia, and diabetic retinopathy is the leading cause of blindness in working-aged adults. It affects the retina, which is located in the back of the eye.
And how does diabetes affect vision?
We can think of how diabetes affects our eye vessels like a pipe in a home. So although this isn't an exact analogy, I find it very helpful for patients and individuals to see how diabetes can affect their eyes. So over time, the sugar in our blood scratches the blood vessel walls in the back of our eye, causing them to leak and eventually weaken or crack, just like a pipe can do in our home, a leaky pipe. So over time, this can worsen and the blood vessels or pipe can stop working altogether. And there are some symptoms you may have if you experience, if you have retinopathy. Some of those are seeing spots or floaters in your vision, blurred vision, dark or empty spots in the center of your vision, difficulty seeing well at night. And Patricia, one of the most important things is someone may not have any symptoms at all. And this is important to note because you can still have severe disease, meaning the diabetes is affecting your eye without having any symptoms or having great vision. So it's important you complete your yearly diabetic eye screening, which we'll talk about here shortly.
So what can individuals with diabetes do to protect their vision?
So the single most important thing you can do is to get your annual diabetes eye test. Eye disease caused by diabetes is treatable if caught early. You can go to your local eye professional if you already have one to get your eye test done. There are also 5-minute quick exams out there, undilated, that you can have done. We do have that here at Network I. It's a great option. If it is determined that you do have disease affecting your eye from diabetes, you normally go to see a retina specialist, and those are ophthalmologists who specialize in diabetes care of the back of the eye. and they can treat and monitor you to see if their disease is progressing or what the next steps may be. Again, the most important thing to do is to get this eye test completed, along with managing your disease with your primary care provider or endocrinologist, of course. Because as we stated earlier, even if you're not having any problems with your vision, that doesn't necessarily mean that there isn't any retinopathy going on in your eye. It's also important to remember that if you go to get your eyeglasses prescription updated, that doesn't necessarily mean that they're looking at the back of the eye. When we go to get glasses, it's normally the front of the eye that doctor is looking at, where the retina is located in the back of the eye. So I always recommend that our patients are our own advocates, and when they go to their eye care professional, they simply let them know they are living with diabetes, that they want to make sure that their eye is being checked to see if any effects are happening due to the diabetes. And there are a couple things that people can do with diabetes to, preserve their overall health and the health of their eye as well. These include keeping all your appointments with all your physicians and making sure that you're taking your medications as prescribed. That's very important, as well as monitoring your blood sugar and keeping that under control, eating well and exercising, avoiding alcohol and smoking to the best of our ability with that alcohol, and avoiding smoking especially is very important. And if anybody has any questions regarding their diabetes or their diabetes affecting their eye, I recommend that they, call their local eye care professional if they already have one, or if they need one to, reach out to seek care for that. And if they're experiencing any symptoms we discussed, I recommend they reach out as well. And lastly, Patricia, here at Network Eye, we do have a November campaign for Diabetes Awareness Month, and it's called Make the Ask. I know a lot of times people may be a little apprehensive to go get their eyes checked, or they might be a little scared of what might happen. So it's important, and we're asking whether you are or are not living with diabetes, that you talk and encourage your friends and family members to go get that eye check. The world is so beautiful, and we always want to see that for many years to come and protect our vision and, be able to enjoy with all of our family and friends for a very long time.
Great information and great advice. Thank you for being here today, Sarah.
Thank you for having me, Patricia.
November is American Diabetes Month, and it is a great time for you to get your eyes tested, as well as to encourage those you love to get their eyes tested. I'm Patricia Henderson, and this is your Community Connection.